Hello, my name is Ruth Hackett, and today I'm going to be talking about ways to stay socially connected while physically isolated. As with the other presentations you've heard today, if you've any queries about the content of this talk, use the link listed at the top of the slide or text the number, also listed at the top of the slide. So to kick us off, what is loneliness? So it's the perception or the feeling that your social needs are not being met. So it's about the quality of the relationships we have rather than the quantity of relationships we have. And it's a common experience. So survey data indicate that 21% of the UK population report feeling lonely sometimes. And we know that some groups are more likely to report feeling lonely than others. So younger people, aged under 25, along with older people, aged over 65. These age groups are more likely to report feeling lonely than other age groups. Similarly, we know that those who live alone are more likely to report feeling lonely than those who live with others. However, it is important to point out that loneliness is not necessarily the same as being alone, as it's about the quality of relationships we have. So it's normal to feel lonely at the moment, particularly when we're physically distanced from our usual support structures. However, when loneliness becomes chronic or a day-to-day reality, it can become a significant problem for both our physical and our mental health. So we know that loneliness is a risk factor for depression and anxiety, and that lonelier individuals are more likely to report that they have lower self-esteem than non-lonely individuals. We also know from a large number of studies that loneliness is a risk factor for heart disease and that lonelier individuals tend to live shorter lives than non-lonely individuals. And finally, we know that loneliness can reduce our ability to connect over time. So it reduces our ability to form those high quality social connections. So keeping this evidence in mind, it's extremely important at the moment that we try to stay socially connected even though we're physically distanced from our usual social networks and support structures. So we have to intentionally plan to reach out and to contact and keep in touch with our existing support structures. And there's several ways you can do this. So video calling friends and family is a really good one, as evidence suggests that this is more mood boosting than traditional methods such as telephoning and text messaging. Similarly, if you're working from at home at the moment, it's a great way to keep in touch with colleagues as well. So you can use software such as Zoom to have video meetings with your colleagues. And this will not only alleviate feelings of loneliness, but will also help create a purpose and a structure to your day. So although I've mentioned video calling here, the best method of keeping in touch and drawing on social structures and support you already have is the method that you prefer and the one that works best for you. Secondly, although our normal routines are disrupted at the moment, we need to try and add structure to our day. This creates a sense of purpose and meaning and increases our control. And this is mood boosting and helps alleviate feelings of isolation and loneliness. So trying to wake up at the same time every day, have a set work time, and importantly, a set time that you finish work. So it's very important that you make time for leisure and relaxation. And maybe you can even use the time to try out something new or get around to an activity that you've been putting off or haven't found the time to get around to. This is a way you can increase the sense of purpose and control in your life, which will be mood boosting and help alleviate feelings of loneliness. Thirdly, it's very important to acknowledge that it's normal to feel lonely, particularly when we're physically distancing. And we have to acknowledge and accept that feeling. So rather than trying to ignore this challenging emotion, be kind to yourself and try to engage in relaxing and soothing activities, ones that you enjoy, and that will help alleviate feelings of loneliness and boost your mood. So I have some examples listed on the slide here, but these are not meant to be prescriptive. It's about finding the activities that work best for you and that you find most enjoyable and relaxing. These are the best ones you can do, and they will be the most mood boosting for you. Finally, as you've heard in the other talks today, it's very important to proactively engage in positive health behaviours. So, getting out for your exercise, eating well, these are very mood boosting as well as protective for your physical health. And trying to do less of the risky behaviours, so smoking, excessive alcohol consumption, these are not going to be helpful for you in the long term. And I particularly want to mention information seeking behaviours here. So it's important to stay up to date and informed in this rapidly changing situation. However, if you find yourself under pressure to constantly check social media, you may need to limit your exposure. So if you're comparing yourself to others who portray themselves as coping better with the current situation, this may make you feel more isolated or lonelier. And if this is happening, it's important to try and limit your exposure to this media. So, in conclusion, it's important that we reduce feelings of loneliness, reduce feelings of isolation, and stay socially connected in this time of physical distancing. And the top ways to do this are keeping in touch with friends and family and colleagues, particularly over video messaging, having a routine and structure in your day, accepting and acknowledging this is a difficult time, engaging in self care and soothing activities that you enjoy, and finally, engaging in protective health behaviours and trying to limit exposure to distressing social media.